Senator Tom Carper. He's the chairman of the Senate Committee on Environment and Public Works. He's served Delaware in the Senate since 2001. As chair of the Senate Environment and Public Works Committee, Senator Carper has been a leader on Capitol Hill when it comes to slashing pollution and protecting our environment. Because of his leadership, we got the Inflation Reduction Act and the bipartisan infrastructure law across the finish line. Please join me in giving a warm welcome to Senator Carper.
Dr. Patel, come here, don't go, just stand, sit right behind me. Right behind
Okay.
Good afternoon. Welcome to the swamp. That's what this area is called. And every now and then, after it's rained a lot, you would understand why we call it the swamp. But today, we don't have to worry about that. I'm Tom Carper, privileged to serve as Delaware's treasurer, congressman, governor, senator, the last Vietnam veteran serving in the U.S. Senate. And wherever you're from in this country, we welcome you to this place. I am humbled to stand here with all of you today. I just finished chairing a meeting of the Environment and Public Works Committee, which I'm privileged to chair, and our witness, we had one witness, and his name is Michael Regan from North Carolina, and he serves as the administrator of the Environmental Protection Agency. And the message that I gave to Administrator Regan this morning, and actually this afternoon too, is one that I'm going to share with all of you today, and here it is. We need cleaner air, and we need climate action. I'll say that we need cleaner air, and we need climate action. Not tomorrow, not next year, right now. We need it right now. What do you think? What do you think? All right. Let me say this. Administrator Regan and President Biden understand what's at stake. They know, like we know, that we can't wait any longer. Air pollution is bad for our health. Air pollution is bad for our economy. The state that I am privileged to represent, Delaware, is what I call at the end of our nation's tailpipe. More than 90% of our air pollution comes from out-of-state sources. When I was governor of Delaware, we literally could have closed down my state, closed down the economy of my state, and we would still have been out of attainment on a number of environmental standards. That's why we need national action to clean up our air. At the same time, our planet is literally on fire. This week, you may have heard that our world's leading scientists issued a report saying that without significant climate action, we doom future generations to a world of heat waves, water shortages, and more flooding. Here's the good news. Here's the good news. We're making progress. Last Congress, we made historic investments to reduce air and climate pollution, especially for environmental justice communities through the IRA, the Inflation Reduction Act, and bipartisan infrastructure law. Now we need the Environmental Protection Agency to also enact stronger clean air and climate protections. Clean air and climate action by EPA will reduce the pollution that's bad for our health, bad for our climate, and while at the same time creating new economic opportunities for our nation. Some people don't think you can have cleaner air, cleaner water, address climate change, and create jobs. It's a false statement. We can do both, and we've got to do both. What do you think? We've got to do both. Let me end by saying that President Biden, along with Administrator Regan and Democrats in the Congress, and one or two Republicans as well, will continue prioritizing our health over polluters' profits. With that in mind, I want to again thank all of you for all that you do to try to make clean air not just a pipe dream, not just something we talk about or give speeches about, but a reality for all Americans and frankly for everybody who lives on this planet with us. And now with that I don't know if Congresswoman Sheila Jackson is here. Is she? Is she? She's in transit. Okay. All right, let me say to Dr. Patel, who should I...
Yeah, I'll go next.
All right. All right. Filling in for Congresswoman Sheila Jackson is a woman who introduced me. Dr. Patel, take it away.
Yep.
Where are you from?
I'm from San Francisco.
Okay. Do you know my son Christopher who lives out there?
I don't.
No?
It's a big city.
He looks just like me, only about 30 years younger. Nice to. Thank you for your leadership.
Yes.
Give her a big round of applause. Go ahead. Come on.
Thanks, everyone. So I'm here today as a mother, a pediatrician, and the executive director for the Medical Society Consortium on Climate and Health. I'm speaking for my 2 children, my patients, and the 700,000 doctors represented by our 48 member societies. As a mother, I worry about the toxic pollution my 4 and 8-year-olds have been breathing almost every year of their life since they were born. Climate change caused by the burning of fossil fuels is causing worse wildfires each year. Living in the San Francisco area, we can expect the amount of wildfire smoke to increase by 50% in their lifetime, placing them at higher risk for asthma, certain types of cancer, and heart disease. As a pediatrician, I care for infants, including those born prematurely, and children sick enough to be hospitalized. I'm here because I see more premature infants in our neonatal intensive care unit. The science is clear, and air pollution is a driver for prematurity and low birth weight infants. Just last week, I had to counsel a tearful expectant mother about to deliver an infant 2 months early with no known medical risk factors other than living in a highly polluted area. She asked if it was her fault. The reasons for premature labor are complex, but we know exposure to air pollution is a risk, and that is not her fault. It is our broader failure to keep people safe from foul fossil fuel pollution. I'm caring for more and more children with asthma attacks and with heat strokes requiring hospitalization. Climate change is making all of these worse. We are all harmed by air pollution and climate change, but we know that burden is not equal. People of color and people living in poverty are far more likely to breathe the most dangerous air because polluting fossil fuel industries are more likely to be built in and near their communities. In these neighborhoods, people who are pregnant and children who are exposed to foul pollution, they are exposed continuously. Before a baby takes its first breath, it has already been exposed to the fossil fuel pollution its mother has breathed in. The pollution crosses the placenta and enters the infant with its developing lungs. As stark as this picture is, I'm here because we can act today to address climate change and make our families and communities healthier and safer almost immediately. Decisions to enforce stronger regulations of soot, methane, and other climate pollution, and switching to clean energy sources like wind and solar give us cleaner air and water, more affordable energy, and reduce the pollution that causes climate change and poison our people. To protect the health in our communities, especially those who've been traditionally overburdened by pollution, we need to act now. That is why, together, the undersigned experts are calling on the administration to use their existing authority under our nation's bedrock environmental laws, such as the Clean Air Act, to finalize the strongest possible standards to protect public health in our environment. We've been encouraged to see movement on several critical standards like cross-state air pollution, methane pollution, and heavy-duty vehicles, and we have a signed letter by health professionals asking for the support that we will be delivering to the EPA and the White House. Climate change will be the greatest determinant of health for a child born today. And while this administration has passed significant pieces of legislation to address the climate crisis, we still have a ways to go. Finalizing strong solutions for pollution can help us get the rest of the way there to ensure all children can thrive rather than merely survive.
And now?
Is Representative Sheila Jackson Lee here yet? No? So then I will turn it over to Juan Flores from LULAC Houston, Air Alliance Houston.
Gracias. Check. All right. Well, good afternoon. Good morning, everybody. My name is Juan Flores. I work for Air Alliance Houston. I'm the Community Air Monitoring Program Manager. I'm also the Vice President for LULAC Council in Galena Park in the Houston area. And I also represent as Vice President of ECAP, Environmental Community Advocates of Galena Park. And we are focused with our organizations on trying to improve the air quality and trying to improving the health outcomes of our communities, as we are suffering so much from the effects of air pollution in our area. And our communities are very much impacted health-wise by having higher asthma rates, having higher cancer rates in our area, something that really affects our community, affects our health. It affects me personally. My health is being affected by this, as well as my kids. And we're here today to ask the Congress here to pass some new laws to try to help enforce these standards that are not being enforced in our community. Being from Texas, sometimes we can't really rely on our agencies in Texas to watch over us, and we're asking here on a national level, the EPA and the Congress here to help us, to watch over us as we are struggling to fight these injustices going on, environmental injustice going on in our communities, and that's something that we're here to do today. And one of the things that we're asking for right now is to enforce the standards, higher standards on enforcing, trying to cut back on deadly suit, or as they call it, particular matter in our area, which is one example of the injustices we're going through in our area. I'm here today to announce we are delivering 600 written letters, handwritten letters that was written by community members in our communities. And we're here to deliver these to the EPA, and we're calling on the Biden administration to please set strongest possible suit pollution standards as possible to cut back on this injustice that we're all going through. These letters were written by residents, young and old. These letters are coming from people from Houston, Laredo, El Paso, Tampa, Florida, San Bernardino, and Vista, California, and beyond. And some of our young adults and people that wrote them are here behind us here today in the crowd that came all the way down from our respective communities to ask for these changes and to ask for these standards to be put in place. And President Biden, we are counting on you to fulfill your promises on environmental justice and enact stronger standards on suit pollution or particular matter pollution as we try to improve our communities. And we can't, we get frustrated sometimes being down in the community level trying to fight these big refineries, big companies. It's such a hard battle for us to have, and that's why we came here to D.C., Washington, D.C. today to ask our lawmakers to please help us. Please help us protect our communities, to protect our young, old people, everybody here, as we try to really make some changes in our community. So thank y'all so much for having us here, and it's my pleasure to introduce the next speaker, Dr. Greg Fury, Medical Director for Climate at Birmingham Women's Hospital. Is she here?
Good afternoon, everyone. My name is Greg Fury. I'm a primary care doctor at Brigham and Women's Hospital in Boston, where I also serve as the Medical Director for Climate and Sustainability. I'm a member of the faculty at Harvard Medical School and a member of the Healthcare Without Harm Physician Network. But of course, my most important job is as a parent to two amazing children who face a frightening future on a rapidly warming planet. It's with that perspective that I'm urging President Biden and his administration to use every tool at their disposal to clean up dangerous pollution and address the inequitable burden of health effects borne by Black and Brown and other socioeconomically disadvantaged communities. For those of us on the front lines of healthcare, connections between human health, fossil fuel combustion, pollution, and climate change are all too apparent. In my own practice, I care for climate refugees, such as a patient who fled Puerto Rico when prolonged power outages after Hurricane Maria prevented him from receiving dialysis. I recently made my earliest diagnosis of Lyme disease, which has a longer active season due to rising temperatures. My patients' allergy symptoms begin earlier in the spring and last later in the fall, and my elderly patients, appropriately fearful of the risks of extreme heat, are confined to their homes more and more. And I can't help but wonder how many of my patients' asthma flares, heart attacks, strokes could be avoided if we collectively agreed that it's unacceptable, irrational, immoral to continue causing death and disease by burning fossil fuels when ample supplies of clean energy exist. Every day I care for patients whose illnesses could be avoided by prioritizing health and placing the strictest possible standards on soot, carbon, and smog pollution. On the national level, air pollution causes over 100,000 deaths annually and countless more flares of respiratory disease, heart attacks, strokes, adverse pregnancy outcomes, and other negative health effects. There's no acceptably safe level of air pollution. Mortality has increased at levels below current national limits and even below the new limits proposed by the EPA. Climate change, also primarily due to fossil fuel combustion, is amplifying the frequency and severity of death and disease through hotter temperatures, extreme weather events, wildfires, and effects on food supplies and nutrition. Damage to healthcare facilities and disruptions to their supply chains from extreme weather impair our ability to provide essential care. It's increasingly clear that none of us are immune. Our entire country is vulnerable to the health effects of climate change, although unfairly some, in particular communities of color, more so than others. From the perspective of a physician, urgent policy action on pollution is a moral imperative. But in a country straining under the rising cost of healthcare and more frequent and expensive natural disasters, bold action to reduce soot and carbon pollution is an economic imperative as well. The cost of reducing soot and carbon pollution would be easily offset by the associated savings in healthcare costs. It's for both these reasons that my health system, Mass General Brigham, has committed to reducing our own emissions, because polluting is fundamentally at odds with our mission of promoting health and well-being. But we can't do it alone. In healthcare, we often say that prevention is the best medicine. Preventing death and disease from air pollution and climate change requires a policy solution, not a medical intervention. President Biden and his administration have the opportunity to save more lives than my colleagues and I ever will. But time is running out. To protect public health, we must enact ambitious pollution standards now. Thank you. And with that, I'd like to turn it over to Adriana Nava, President of the National Association of Hispanic Nurses.
Hello, my name is Adriana Nava. My name is Adriana Nava. I'm the president of the National Association of Hispanic Nurses, and our mission is twofold. We're increasing the diversity of the nursing workforce to address Latino health issues across the country, as well as making sure that we're involved in advocacy and policy. And one of those topics being the reason we're here today is to advocate for clean air, especially as it impacts our Latino community at a greater impact. The evidence on the impact of poor air quality on health is well established. And in fact, the 2022 State of Air Report has let us know that there are more days with very unhealthy and hazardous air quality than ever before in the history of this report, which is both alarming and deeply concerning. At NAN, we have focused on increasing the number of nurse leaders who are addressing climate change, and we're really happy to highlight one of our very own, Dr. Roxana Chicas, at the Emory School of Nursing, where she is looking at interventions to impact the health and improve the quality of workers, agricultural workers on the front lines who are working to provide resources to our country. So just highlighting that as an organization, we're really working to address the impact of climate and air quality on our community. And as we look into the future, the health of our most vulnerable populations are at risk that go beyond just our Latino community to include our children, older adults, pregnant women and their unborn children, individuals who work outdoors, all communities of color, and individuals with pre-existing conditions such as asthma and cardiovascular disease. So basically, this topic impacts everyone that we know or love, and they're at risk due to the poor effects of air quality. As members of the largest healthcare profession of the country, we represent over 4 million nurses, and we are trusted health experts who work closely with the communities we serve. So we're here today to advocate for policies that advance a more sustainable future and improve the quality of air that everybody breathes, because we deserve better. Our standards are out of date and they need to be aligned with the latest research. We deserve better, and our air quality is slowly deteriorating, and the future generations of America deserves better. Thank you.
Thank you. Hey, what's next?
I believe Sheila Jackson Lee was unable to make it because of a late flight. So I think that's the end of our...
No, let me say
Oh,
something else.
sure.
How many of you here own a car? How many own a car? How many own a truck or an SUV? 10 years ago, I was at the Detroit Auto Show, and I met a woman who actually became CEO of General Motors. And her name's Mary Barra, and that year, 10 years ago, the car of the year at the Detroit Auto Show was the Chevrolet Volt. Chevrolet Volt was a hybrid. It got about 38 miles on a charge. And I remember talking with Mary Barra, who later would become the CEO of General Motors. We talked about the Volt, and she said, I realize, this is what she said to me, she said, I realize that electric cars are the future. That's the future. That's where we're going. They're energy efficient. They're cheaper to maintain. That's the future. That's where we need to go. You said three things have to happen before people are going to buy all these electric vehicles that someday we hope to make. Number one, she said, we need not 100-mile range. We need not 200-mile range on a charge. We need 300 miles. And she said, that's up to us, the industry. She said the second thing that we need is the ability to charge and recharge batteries in minutes, not hours. She said that's on us, that's on the industry, not on the Congress or the President. And now we have, as you know, batteries we can charge in minutes, not hours. The last thing she said that we need is we need charging stations all over the country where people can charge their cars, their trucks, their vans, and or maybe they're using hydrogen, they can get hydrogen that they need for their vehicles. So that's what we need. I can't tell you how much money we put in the IRA, the Inflation Reduction Act, and also in the bipartisan infrastructure bill, just for that purpose, to build out a national network of vehicle charging stations, electric charging, and also eventually for hydrogen. A couple of our speakers today have called on the administration to do X or Y, or the Congress to do X or Y. As it turns out, we have done X or Y. We've done all kinds of stuff. And we're now implementing the things that we've done. I'll give you one more quick one that's underway, and hopefully we can build on this. I'm from Delaware. We have chickens. For every person in Delaware, there's 200 chickens. That's a lot of chicken. In our state motto should be eat chicken. But in some states, they have cows. One of the states they have a lot of cows in is California, where our son Christopher lives. And they have cows, create a lot of methane, a whole lot of methane. And over in California, they've been trying to, what are we going to do with all this methane? And what they've decided to do is take methane. Anybody ever been to the San Francisco airport? Everybody ever fly into SFO? If you fly into SFO, you'll notice they have recycling in SFO. For recyclables, they have stuff that can be landfill. They also have food waste. And you know what they do with the food waste in the Bay Area? They collect it, they combine it with cow manure in an anaerobic process, and it creates a reusable fuel, a gas, if you will, for cars, for trucks, and for buses. In the IRA, the Inflation Reduction Act, we actually created a methane emission reduction program, not for cows, but literally for methane that's emitted and leaked by folks who are drilling gas wells and fuel wells and so forth. We're doing this stuff. We put in place the incentives that we have to do, we need to do in the tax code, and to provide EPA with the resources that they need. So this is a good news story. There's a lot of work to be done, but it's a little bit like, I'll close with, when I was stationed in the Navy during the Vietnam War, we was a P-3 aircraft mission commander. We had a term that was called refusal speed. And we would do our pre-flights for our missions over there, and we'd get in our plane, and we'd get in the plane. We'd start the engines, and we'd ask for clearance and get a clearance to take off. And we'd start down the runway in our airplanes, and we'd reach a speed called refusal speed. And it's a speed at which you either decide, if the pilot of the plane, to either take off and fly or pull back on the throttle and stay on the ground. It's called refusal speed. We're at refusal speed right now as a nation. We're at refusal speed as a nation. And if we're smart, we can increase the speed at which we're adopting these reforms, adopting these incentives, and save our planet for ourselves and our children. Lastly, right over my right shoulder is the Capitol. About 3 years ago, we had a special guest speaker, and he spoke French. He also spoke English pretty well, too. His name's Macron. He's the Prime Minister and he was here about 2 months ago, and President Biden hosted him for state dinner. I got to see him again. And President Macron has this saying, he says, this is the only planet we're going to have. This is the only planet we're going to have. There's no planet B. No planet B. And we have to use our time on this planet to make sure that our kids and our grandchildren are going to have a planet they can grow up on and grow old on. The great thing about addressing climate change and all these things that we're talking about here, the great thing about it, we can do it and create jobs and economic opportunity. Not just a few of them, millions of them. Millions of them. It's like having your cake and eat it too. In our state, we like to have our cake and eat it too. And we also would like for you to eat more chicken. Thank you very much.